pleasant day, everyone. Before anything else, I would like to introduce myself and my groupmates. I am Zarindale Naidas, and my groupmates are Kenneth Maribay, Angelica Matus, Jan Paulo Mina, Rezabel Natay, Asencio Acampo, Marian Jane Palor, Marian Pastor, and Charlene Pineda. And we are the Group 4. And we will be discussing about the clinical symptoms and disorders of the skeleton. Let's go first with the clinical disorders of the skeleton.
Pleasant morning, I am Kenneth Maribay, and today I'll be discussing about ankylosing spondylitis or axial spondyloarthritis to DJD or degenerative joint disease. First, we have the ankylosing spondylitis. So ano nga ba tong ankylose? Ankylose is a joint or bone that becomes stiffened. Spondylitis or spondyloarthritis is a type of arthritis that causes inflammation in the joint and ligaments of the spine. This disorder is common to young men that in the long run it can cause bones to fuse. Fusing of the bone is very dangerous that results to a less flexible bone and results also to hunch posture. Ano nga ba tong hunch posture na to? Ito yun. There are two types of this. First, we have the ankylosing spondylitis. Second is the non-radiographic axial spondyloarthritis. Ankylosing spondylitis can be seen in an X-ray, but in the non-radiographic, basing from the word non-radiographic, it can be seen on an X-ray, but it can be seen through blood tests and symptoms. However, axial spondylitis or ankylosing spondylitis has no cure, but treatments can possibly slow the progression of the disease. Moving on, we have the ankylosing. Ankylosing is basically an immobility and fixation of the joint. And then we have also the arthritis. Arthritis is an inflammation or swelling of one or more joints. Then chondrosarcoma. Chondrosarcoma is too easy to understand, in which is a malignant tumor. So what comes to your mind when you hear a malignant tumor? Malignant tumor is basically cancerous cell. And then we have the curvature of the spine. Curvature of the spine is an exaggerated spinal curve such as scoliosis, lordosis, because it is an abnormal lateral curvature of the vertebrae which usually occurs on our cervical vertebrae, thoracic, and the lumbar region. And then we have the last one, the DJD or degenerative joint disease. So degenerative joint disease is when tissues in the joint breaks down over time, wherein it is common to all people, or your mother, your father, your grandmother, grandfather. It is a type of arthritis in which it is found on our patella and is called osteoarthritis. When they're standing in a long period of time or even in a short period of time, they felt a stiffness or they are in pain. That is called osteoarthritis or the degenerative joint disease, like this. And then, that's all. May I call on also the next presenter to present their topic.
So, the disorders that I am going to discuss are fracture, gout, herniated disc, kyphosis, lordosis, and osteoarthritis. First, fracture. So, what does fracture mean? So, fracture is a partial or complete break in the bone. So, fractures commonly happen because of car accidents, falls, or sports injuries. A fracture is classified as either open or closed. So first, open fracture is also known as compound fracture. So, open fracture when the bone pokes through the skin and can be seen. As in talaga nakikita mo yung bone na nakalabas na dun sa skin. So, closed fracture naman is also known as simple fracture. So, the bone is broken but the skin is still intact. Hindi nakalabas yung bone. Hindi mo makikita yung bone na nakalabas dun sa skin na. So, next, gout. So, ano nga ba ang gout? So, ang gout ay isang metabolic disease na kung saan tumataas ang uric acid level ng ating katawan. So, ang gout ay nagpre-precipitate at nagde-deposit ng mga uric acid crystals. At ito ay nagdudulot ng pamamaga at tissue injuries, kaya nananakit ang ating mga joints. Third one is kyphosis. Ano nga ba ang kyphosis? Kyphosis is a common spinal disorder. It is an exaggerated forward rounding of the upper back. So, ito yung tinatawag nating kubo sa Ilocano at kuba naman sa Tagalog. So, this is common to older people. Fourth one is lordosis. Ano nga ba ang lordosis? Lordosis is a natural curve of the lower part area of the spine. So, lordosis, when the lower back will have a deep curve causing the stomach to stick out or the abdomen. So, magpapaharap yung abdomen while the pelvis or hip area will curve back and up. So, this picture shows the difference between kyphosis and lordosis, wherein kyphosis is the curve at the upper back of the spine, while lordosis is the curve at the lower part of the spine. Pag-usapan naman natin ngayon ang rayumang kadalasan nating nakikita sa mga nagkakaedad na. Ito ang osteoarthritis. So, ang osteoarthritis ay isang uri ng rayuma na kung saan nasisira na ang joint at naninipis na ang cartilage o yung pinakaswelas ng buto. At lumiliit na rin yung joint space na kung saan ito yung dahilan ng pagkikiskisan ng mga buto. One is herniated disc. So, yung disc is the thing between the bones in the spine. So, they act like a spring. Imagine nyo na lang yung spring. Di ba yung spring, you can squash it and bend it sideward. But then, if you try to twist it and change its position, so it's done. It will going to warp the wire and it will no longer be functional. So, a herniated disc is when the disc moves out of the position where it's supposed to be.
Everyone, I am John Paulo Bimina and I will discuss my part in the clinical symptoms and disorders of the skeleton. First, I will discuss what is osteogenic sarcoma. Osteogenic sarcoma is a malignant bone tumor due to DNA mutations inside bone cells, either inherited or acquired after birth. Osteosarcoma often starts at the end of the long bones, where the bone tissue forms as young persons grow. Any bone in the body can be affected. Some symptoms or will affect of this osteogenic sarcoma. First is the increase with lifting. This will affect your arms. Limping also, it will affect your leg, and the last is the limited movement. Um, this, this will affect your joint. Also, that is osteogenic sarcoma. The second is the osteomalacia. So, what is osteomalacia? Osteomalacia is a softening and weakening of the bone due to vitamin D deficiency or other disease. So, itong osteomalacia is yung panghina ng buto dahil sa kakulangan ng calcium to strengthen our bone. So, what are the symptoms of this osteomalacia? The first symptom of this osteomalacia is pain felt in the bones and joints. The second is the muscle pain and weakness, particularly following exercise. Third is bone that breaks more easily, particularly those in the hips, lower back, and the feet. So, pansin nyo sa mga nag-age ng 70 up is yung common na body part nila na mahina na is yung back, hips, ganun pa. Sa feet, yun yung pinaka main na nanghihina sa ganung age. The next is difficulty walking and change in the how you walk. Possibly with a wheel. So the last is the muscle cramps. Uh, so that is the osteomalacia. So we move on to the osteomyelitis. So what is osteomyelitis? Osteomyelitis is the inflammation of the bone and bone marrow caused by infection usually. So osteomyelitis occurs when bacteria from nearby infected tissue or an open wound circulate in your blood and settle in bone where they multiply. Uh, the Staphylococcus aureus bacteria or the staph infection is the typically cause of this osteomyelitis. It results from an infection, uh, parang patay na parts sa bone, yung tinatawag na osteomyelitis. Yung result ng infection due to diabetes, especially a diabetes related in foot ulcer. So next is the metal implant in bone, uh, such as the screw. The next is the pressure injuries. Pressure injuries or bed sores. And the last is the recent broken bone or bone surgery. Next, the osteopenia. So what is osteopenia? Osteopenia is a lower than average bone density which may foreshadow osteoporosis. Uh, Osteopenia is a condition that begins as you lose bone mass or your bone gets weaker. Unlike sa osteoporosis, which is discuss natin mamaya, osteopenia is this happens when the inside of your bones become brittle from a loss of calcium. It's a very common as you age. Total bone mass peaks around age of 35. So kadalasan siyang nakukuha from the age of 35. Dun siya na commonly common mo siya nararamdaman or common siya na nangyayari. Madalas din nangyayari itong osteopenia sa mga babae, especially after sila mag-menopause, because have a much higher risk than a man developing the condition. So, ang osteopenia is hindi pa naman siya totally dangerous kumpara sa osteoporosis. So, let's see what is the differences of the two. So, we move to osteoporosis. So, what is osteoporosis? Osteoporosis is a condition characterized by reduction in bone density. Most common in white women past menopause. Predisposing factors includes poor diet, inactivity, and low estrogen level. So, yun na yung osteoporosis. Yun na yung low calcium intake contributes the diminished bone density, early bone loss, and increased risk of fractures. Eating disorders, severely restricting food intake, and being underweight weakens bone in both men and women. So etong osteoporosis is pwede mo din siyang mamana sa mga magulang mo or makuha mo sa bisyo like pag-inom at paninigarilyo. kadalasan din. So, ang osteoporosis, tinatawag din siyang silent disease kasi wala siyang there are no typically symptoms uh, until a bone is broken. So hindi siya nagpapakita ng symptoms. We move to the last, which is the Paget disease. So what is Paget disease? Paget disease is the skeletal disease of the elderly characterized by bone thickening or distortion with bowing of long bones osteolysis. So some evidences suggest that paramyxovirus infection is the underlying cause of the Paget disease. So, ang common na dahilan ng Paget disease is the paramyxovirus infection. So, also, nakukuha ito, na-acquire ito only rarely in the people under the age of 40. Yun, nakuha siya. So, that's my part in the clinical symptoms and disorders of the skeleton. So, again, I am John Paulo Bimina, BSN 1A student. Thank you.
A pleasant day to everyone. I am Zyrindale Vinaidas, a BSN 1A, and I am going to discuss Pat's disease, rheumatoid arthritis, rheumatoid factor, rickets, sciatica, and scoliosis. Pat's disease, inflammation of the vertebrae usually caused by tuberculosis. So, Pat's disease is commonly known as spinal tuberculosis. So the symptoms of Pat disease are back pain. It is usually happen at night when sleeping. And the other symptoms are fever, cough, loss of weight, evening rise of temperature, or sweating. So if you have these symptoms within 2 to 3 months, there is a doubt that you have Pat's disease. So mas mabuti nang magpa-check up ka, magpa-x-ray, magpa-CT scan, bone scan, para mas sigurado. And the best treatment for this disease is isoniazid and rifampin. This is used to treat tuberculosis. And the result of this disease is parang nagdi-disform yung spine mo. Parang nag-curve siya ganun. And this is the example of Pat's disease. Rheumatoid arthritis, a chronic autoimmune disease of unknown origin resulting in inflammation and peripheral joints and related structures. It is more common in women than men. So this disease mainly attacks joints in hands, wrists, and knees. It is a condition that can cause pain, swelling, warmth, and stiffness in joints. This is usually happen especially in the morning or after sitting for a long time. So the symptoms of this disease are tiredness, lack of energy or fatigue, poor appetite or not feeling hungry, loss of weight, fever, sweating, dry eyes, and chest pain. So, if you have rheumatoid arthritis, your immune system can cause inflammation inside the joints or a numbers of joints. So, if you have these symptoms and sumasakit-sakit yung mga joints ng mga kamay mo, ganon, you better go to a doctor at magpa-check up. And this disease can be effectively treated and managed with medications and self-management strategies. Get physically active. And this is the example of rheumatoid arthritis. I mentioned it a while ago that rheumatoid arthritis is more common in women than men because women produce estrogen. Rheumatoid factor, a group of antibodies found in the blood in case of rheumatoid arthritis and other systematic disease. So, rheumatoid factor is a test done if you want to evaluate for rheumatoid arthritis. So, rheumatoid factor has been detected in our blood. So, bale ito yung tumutulong sa atin para makita if meron ba tayong rheumatoid arthritis or other autoimmune diseases. So this is an example of rheumatoid factor blood test. Rickets, a faulty bone formation in children, usually caused by deficiency of vitamin D. So rickets is a condition that affects bone development in children. A lack of vitamin D or calcium is the most common cause of rickets. So children with rickets must expose to sunlight and eat some foods that is rich in vitamin D, such as vegetables, especially the green vegetables, and etc. And this is an example of rickets. Sciatica. Sciatica is a severe pain in the leg along the course of the sciatic nerve. It is usually related to the spinal nerve root irritation. So, ang sciatica ay sumasakit mula sa lower back, hips, buttocks, and down to our lower extremities. So, it is only affect one leg. At nangyayari ito when we are walking. So, sumasakit sa bandang buttocks pababa at sabi nila namamanhid din ito minsan. But there are ways to prevent this pain, such as do regular exercises, proper posture habang nakaupo, ganon, and gumamit tayo ng proper body mechanics. And this is sciatica looks like. Scoliosis. Scoliosis is a sideways curvature of the spine in any region. So, as we all know, our spinal column is straight, but when scoliosis is present, you will see a sideways shift of the spine to the right or to the left. Scoliosis is defined as curve greater than 10 degree, at it is most common happen sa thoracic and lumbar region. The most common cause of scoliosis is called idiopathic, which means cause unknown, and any one of us ay pwedeng magkaroon ng scoliosis. And this is scoliosis looks like.
So, hi, I'm Rizabel Sinatay and I would like to discuss my topic about spondylocystosis, spondylolysis, achondroplasia, Baker cyst, and bunya. So here is the clip. I would like to discuss to you a very difficult term to pronounce, spondylolisthesis. Spondylolisthesis in Latin, spondo means spine and listhesis means slippage. Intervertebral disc consists of a thick outer layer with a crisscrossing fibrous structure. Annulus that surround the cell-like center called the nucleus. This function like shock-absorbing spring, the annulus pulls the vertebral bodies together against the elastic resistance of gel-like nucleus. When you bend, the nucleus is act like a ball bearing, allowing the vertebral bodies to roll over incompressible gel. This is the condition of a normal intervertebral disc. Spondylolisthesis is a condition where vertebra slips forward onto the vertebra below the disc is deformed. Lumbar spondylolysis is a condition in the lower back where there is a defect or fracture in the part of the vertebrae known as the pars interarticularis. The pars interarticularis, also known as the isthmus, is a segment of bone that connect the facet joint at the back of the spine. It is a small thin part of the lamina that has a poor blood supply which make it susceptible to stress fracture. Fractures of the pars interarticularis known as spondylolysis usually occur at the L5 to S1 level and rarely at L4 to L5 or higher. They can occur on one side of the vertebrae or on both. Spondylolysis usually occur in children between the ages of 5 and 7. It is sometimes called gymnastic fracture because it is associated with sport that required a lot of bending backward. It is thought the repetitive stress on the spine has cumulative effect that causes the pars interarticularis to break. Spondylolysis sometimes causes spondylolisthesis, which when vertebrae slips forward on the vertebra below it.
That's all for the clinical disorders, and now let's proceed to the clinical symptoms of the skeleton.
So what is achondroplasia? In achondroplasia, A means without, chondro means cartilage, and plasia means growth. This is basically impaired cartilage growth or proliferation. This is common cause of dwarfism. As you may notice from this picture, these individuals have a normal head and have a normal trunk. And the reason that this occurs is, if you may recall the embryology, there are two types of bone formation. The intramembranous, for information, this is not affected. However, you may notice in this individual that extremities are shorter, they are not developed properly. This is due to impaired endochondral cartilage bone formation. Achondroplasia tend to be sporadic. It has an autosomal dominant pattern. Fertility, lifespan, and mental function are not affected in this individual. So they have normal fertility, lifespan, and mental function. So looking at this X-ray, you may notice the long bones have not developed properly. And the reason that the long bones don't develop properly is because the main mechanism that the long bones grow is due to endochondral bones formation. And last, they have also a trident hand. So this is how the trident hand. There is a gap between the middle and the ring finger. Baker cyst. A Baker cyst is benign, fluid-filled cyst in the back of the knee, usually a joint condition such as arthritis or meniscus tear, will cause the need to produce joint fluid. When it overflows, it goes to the back of the knee, forming a Baker cyst. And when too much joint fluid is produced in the knee, the fluid goes spillway in the backs of the knee, forming the Baker cyst. Bunion cyst. So what is bunion cyst? The medical name for bunion is hallux valgus. Hallux refers to the big toe and valgus refers to the angle of deformity. A bunion is a bony lump that is created by deformity at metatarsophalangeal joint or MTP joint at the base of the big toe. The first metatarsal become angled medially towards inside of the foot. The big toe or the hallux joint becomes angled laterally toward the other toes, and the MTP joints become inflamed and enlarged. This creates a bony lump at the base of the big toe. Overtime stress on the joint can result in osteoarthritis. Bunion develops slowly. The cause is not clear, and they can become painful, particularly when walking and wearing tie shoes.
Hi guys, my name is Asencio Ocampo, a Bachelor of Science in Nursing Level 1. Today, I will discuss about bursitis, carpal tunnel syndrome, chondroma, exostosis, Ewing sarcoma, and the giant cell tumor. Okay, today we will proceed about bursitis. What is bursitis? Bursitis is an inflammation of a bursa, of small fluid-filled sac near a joint. Causes include injury, irritation, and joint disease. The shoulder, hip, elbow, and the knee are common sites. So I have prepared some pictures for you to have idea what is bursitis looks like. Here guys. This one is a bursitis. As you can see, may bukol dito sa elbow niya. This is what we call bursitis. Pansin nyo guys, pag nauuntog yung kamay natin ng paulit-ulit or yung elbow natin, namamaga siya. Yun yung tinatawag na bursitis. Ganyan. Ganyan siya. Ito yung parang pamamaga ng elbow. And then, Next is carpal tunnel syndrome. What is carpal tunnel syndrome? A numbness and weakness of the hand caused by a pressure on the median nerve as it passes through a tunnel formed by the carpal bones. This is what we call carpal tunnel. Ganto siya guys, dito. Ayan. Pag pinipress mo siyang ganyan, pansin nyo, pag pinipress natin yung ganto natin, nagiging manhid siya. Dito siya nagiging manhid. That's what we call carpal tunnel syndrome. Ito yung nerve na naiipit kaya siya nagiging manhid. Yun guys. Next is the chondroma. Chondroma is a benign tumor of cartilage. Ito yung parang ano siya guys? So, bukol-bukol na tumutubo. Ayan. Ganyan siya. Chondroma, this is a type of bone cancer. Ganto, ito siya. Bone cancer. Ito na tumutubo. That primarily affects the cartilage cell of the femur, arm, pelvic, knee, and spine. This is the example of the chondroma. Ito yung mga bones na tumubo. Usually guys, sa kamay talaga siya tumutubo. Kaya ayan, ganyan. Ganyan yung itsura niya. Next is the Ewing sarcoma. Ewing sarcoma is a bone tumor that usually appears in the children 5 to 15 years of age. It begins in the shaft of a long bone and spread readily to other bones. It may respond to radiation therapy but then returns. Tawag dito, bumabalik din siya guys. Also called Ewing sarcoma. This is what Ewing sarcoma looks like. Ayan. Ito yung tumor na tinatawag. Ito yung bone. Ayan. Ito yung tumor na nakapaligid sa bone. This is what we call Ewing sarcoma. Ito siya. Ito siya part. Ito yung itsura niya. Ganyan siya guys. Ito. Yan yung tinatawag na tumor. Ayan. Ewing sarcoma, this is a type of tumor that spread in the bone papunta sa lungs. Tumor na namamagitan sa buto. That's what look like guys. Next is exostosis. Exostosis is an extra growth bone. Ito yung mga tumutubo na extra bone sa pwede siyang tumubo sa lahat ng parte ng katawan actually. So this is the definition of the exostosis. Exostosis, a bony outgrowth from the surface of a bone. Ganito siya. As you can see guys, ayan, ganyan. Ganyan yung mga tumutubo, ayan. Parang mga bukol-bukol siya pero bone siya, excess bone. Yung mga extra bone na tumutubo-tubo sa lahat ng, pwede siyang tumubo sa lahat ng parte ng katawan. Okay, next, the last one is the giant cell tumor. A bone tumor that usually appears in children and young adults. The ends of the bones are destroyed commonly at the knee by a large mass that does not metastasize. Okay. Ganito siya guys. This is the tumor. We will see yung kamay. Kamay na may malaking tumor. Ayan. Ito siya. Ganyan yung itsura niya pag hindi pa siya na-ooperahan. And then after the operation, this is what the giant tumor looks like. Ayan. Ayan siya guys. Dito siya sa kamay. Kamay kinuha. Itong tumor. This is what giant cell tumor looks like. A giant cell tumor, this is a kind of tumor. It can grow anywhere on the body. But not all giant tumor are cancerous. Hindi lahat ng tumor ay cancerous guys. May mangilan-ngilan naman na cancerous na tumor. It is
Good day, everyone. I am Marian Jane Palar, and I will discuss to you about what is hammer toe, hallux valgus, nudes, hemarthrosis, and multiple myeloma.
Hammer toe, change in position of the joint so that the toe takes on a claw-like appearance and the first joint protrudes upward, causing irritation, pain on walking.
Here's an example of hammer toe. Isa sa mga causes is shoes that don't fit. I don't know if any of you are still using shoes na maliit na sa inyo, but this can possibly happen to you kung patuloy nyo yung gamitin.
Hallux valgus, painful condition involving lateral displacement of the great toe at the metatarsal joint. There is also an enlargement of the metatarsal head and bunion formation.
On the right side, you can see a normal foot, while on the left side, you can see a toes that are bent over. This is what we call hallux valgus. Some symptoms are pain or stiffness, swelling, inability to move or bend your big toe. Some causes are wearing narrow or pointed shoes and standing for a long time.
Nudes. Small hard nodules form in the cartilage of the distal finger joint in osteoarthritis.
This is example of nudes, and as you can see, ito yung mga bukol minsan sa daliri natin.
Hemarthrosis, bleeding into a joint cavity. So nade-develop ito sa knees, elbow, hips, and shoulders. Some causes are traumatic injuries or just injuries like car accident or sports injury. Some symptoms of hemarthrosis are swelling and inflammation, bruising, pain, and trouble of moving.
For example, you fall and you hit your elbow on the ground badly and magkakaroon ng bleeding sa joint mo.
Leg culprits disease, denigration, osteochondrosis of femur's proximal growth center. The bone is eventually restored, but there may be deformity and weakness, most common in young boys, also called the cosa plana.
So this is example of leg culprits disease. There is no known cause for this condition, but what is clear is that when blood supply to the femoral head is disrupted, the bone starts to break down.
Signs and symptoms of Peart's disease include walking with limp, can be painless limp, pain in the hip, groin, thigh, or knee that gets worse during activity, and last, limited range of motion and stiffness in the hip, groin, thigh, or knee.
Multiple myeloma, a cancer of blood-forming cell in the bone marrow.
This happens when a healthy plasma cell become abnormal cells that multiply and produce abnormal antibody. These changes start to cascade of medical issues and conditions that can affect your bones, kidney, and your healthy body's ability to make a healthy red and white blood cells and platelets.
Good day and hello you all, Marian Pastor speaking, and I would like to present my assigned topic about clinical symptoms and disorders of the skeleton. Let's start with neurogenic arthropathy. Due to impaired pain perception, it can result from underlying disorders, most commonly diabetes and stroke. Initially, it may lead on swelling, redness, and increase in our foot and ankle. Second is Osgood-Schlatter disease. It is an inflammation of the patellar ligament at the tibial tuberosity, and it is very common in children, aged 10 to 15 years. This disease may result from repetitive quadriceps contraction such as direct trauma, running, jumping, and most definitely climbing of stairs. Next off, osteochondroma, where it is a bony exostosis projecting from the external surface of a bone, and it is also known as cartilage cape exostosis. And did you know that it can be genetic? Fourth is the osteochondrosis, It is a self-limiting developmental dearrangement of normal bone growth, and a common factor of this disease includes stress. Fifth is the osteodystrophy, an alternation of morphology in patients, wherein a complex of disorders in uremic patient from abnormalities in the present of the uremic state. And last would be the osteogenesis imperfect, a genetically heterogeneous group of collagen disorders, and also known as the brittle bones disease nor the fragilitas osseum, wherein it can result from a defect of collagen production that lends to congenital osteopenia with increased bone fragility manifestations such as dental abnormalities, lax joints, and thin skin. That's all. Thank you.
Osteoma. Osteoma is a benign bone tumor that typically forms on the skull. Depending on where they develop, osteoma sometimes cause symptoms like headaches or sinus infections. So here is an example of osteoma. So osteomas tends to form on the skull or long bone of the body. If the osteoma is formed on the long bone, it is called osteoid ostoma. So here we have three types of osteoma that is recognized. Number one, we have compact. These are made of very dense bone material. Number two, we have spongy. These are similar to normal bone and often include bone marrow. Number three, we have the combined or mixed. These growths have both compact and spongy qualities. So a person may not realize that he or she has a growth until a doctor examines the synostosis or skull due to other health concerns that the person has. So here are some potential locations of osteomas. If it's near the synostosis, cause an obstruction. If it's near the eye, it causes the eye to protrude. If it's on the forehead or skull, it causes headaches. If it's on the jawbone, it causes facial pain or pain when the mouth is moving. And in the ear, cause temporary hearing loss. So doctors do not yet fully understand what causes osteomas. They may be a result or the body reacting to illness or injury. Reiter's syndrome. Reactive arthritis, formerly called as Reiter's syndrome, is a type of arthritis that occurs as a reaction to a bacterial infection in another part of the body. So here are some examples of reactive arthritis. The symptoms of reactive arthritis develop some weeks after the infection. This includes pain, swelling or stiffness in a joint, pain in the lower back and buttocks, pain and inflammation of tendons, pain and redness in the eyes, rash on the palms of the hands or soles of the feet, mouth ulcers, and diarrhea. What causes Reiter's syndrome is sexually transmitted infection or STI such as chlamydia or an infection of the bowels such as food poisoning. The treatment for Reiter's syndrome is antibiotics to treat the infection, non-steroidal anti-inflammatory medicines to reduce inflammation, corticosteroids to reduce inflammation, and immunosuppressive medicines such as methotrexate to control inflammation. Next, we have spondylosis. Spondylosis, it is a condition in which there is abnormal wear on the cartilage and the bones of the neck. So this is an example of spondylosis. All types of spondylosis cause pain and inflammation. The most common symptom is lower back pain. Other signs and symptoms may depend on the kind of spondylosis you have. What causes spondylosis is cumulative joint stress that occurs as people age. Typically, non-operative measures are effective in treating the symptoms associated with spondylosis. Non-operative measures include pain medications and physical therapy. However, if spondylosis resulted in compression of the spinal cord or spinal nerve roots, surgery may be necessary to relieve the pressure. Subluxation. Subluxation is a small misalignment of the spinal segment, causing irritation to a nerve resulting in a loss of normal function. So this is an example of subluxation. So there are three types of subluxation. Number 1, we have the anterior subluxation or forward. This type is the most common. It is localized and purely ligamentous. The bone is not involved. Number 2, we have the posterior subluxation backward. This type of subluxation is very rare, and it is often the result of an injury or trauma. Number 3, we have the inferior or downward. This type of dislocation is also rare, and it entails the joint being displaced downward. So, the causes of subluxations are accidents, falls, sport injuries, birth stress, bad posture, or emotional stress. The treatment for subluxations are resetting the joint, pain relief, rehabilitation therapy, and in severe cases, surgery. Talipes. Talipes are also known as club foot. It is a common foot abnormality in which the foot points downward and inward, usually presents at birth. So this is an example of club foot. There are two types of club foot. Number 1, we have the isolated or idiopathic club foot. It is the most common type. When we say idiopathic, meaning the cause is unknown. Next, we have the non-isolated club foot. Happens along with other health conditions. The conditions include arthrogryposis and spina bifida. The treatment for club foot are stretching, casting, bracing, and surgery. Valgus. Valgus is an anatomical bone deformity wherein a part of the bone abnormally points outward or away from the body. So this is an example of valgus. The primary cause of valgus is genetics. When genetics are the reason for the deformity, both legs are affected with an angle. So the best treatment for valgus is surgery.
Hello, it's me again. I'm Kenneth Maribay, and I would like to end our presentation with my last topic, valgus to von Recklinghausen disease. So first we have valgus. Valgus is a bent outward knee in which it is deformed like this. And then we have varus. Also, it is also deformed, which is also bent just inward like this. And then the last one, the von Recklinghausen disease. Von Recklinghausen disease is a genetic disorder characterized by increased developing malignant tumors and the benign tumors. So what are these malignant tumors and benign tumors? Malignant tumors is a cancerous cells, and a benign tumor is a non-cancerous cell. They develop as one, which is the so-called neurofibromatosis. Neurofibromatosis is an excessive parathyroid hormone which releases calcium by the bone in the bloodstream. It reduces calcium of the bone, which causes the neurofibromatosis like this and like that, and so on and so forth. And that's all. Thank you.
And that's all for the clinical symptoms and disorder of the skeleton. I hope you guys learned in our discussion. Bye!